Hey, this is Dr. Jim. Let's talk today about the new guidelines that were put out by the American Academy of Pediatrics to care for, evaluate, and to ongoing treatment of those with ADHD. As pediatricians, we look to the Academy of Pediatrics to give us guidelines to care for all types of diseases and entities and everything that we deal with as pediatricians. The last guidelines that came out for the Academy of Pediatrics were in 2011. The exciting part of these guidelines to me as a physician are as what it does for the Academy of Pediatrics as a whole. It underscores to pediatricians, the 60-some thousand pediatricians everywhere, that it is so important for us as physicians to understand that there's a comorbidity out there with these kids, meaning that, gosh, anywhere from 30 to 40% of the children may have something else besides ADHD. Anxiety, depression, mood disorders, autistic spectrum disorder. So we've got to figure that out. Also, there's a whole problem with the preschool child. So now the preschool kids are going to get the care that they need, and the adolescents. And on top of all that, we're going to really train parents in schools. So it's really exciting for me to see what I think is the Academy coming out of the dark ages of ADHD into the light of all the aspects of taking care of kids that have attention and focus issues. As super as these updates are, all updates land short. As a physician, what would I like to see differently would be I want to see more about medication. I want to see new medications. I want to see a difference. We've not changed how we treat children and adolescents with ADD for years and years and years. We just come out with a different formulation. So I want to see how we can help and affect change with kids. What is the effect of nutrition? We know that it helps. Give us some really good guidelines for that, and to give good guidelines to parents coming from the academy with that. What about a lot of things that are not approved by the FDA that we know work? What are things that have not don't work all the time, but we know that they work? Can we not come up with some ideas and things to help physicians on a day-to-day basis in our office to help the parent who day to day is having a heck of a time caring for their child in the morning, getting them ready for school, in the evening, homework, the stresses of the family? That's where I want to see us as an academy. That's what I would like more of guidelines. I want where the boots in the road meet. I want help right there. These guidelines came out to General Pediatric Society. I would like to see really some strong guidelines going to the medical schools and the pediatric residency programs, and then to physicians that are caring for those with ADD. Not just a simple boom, 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 but to really give us some strong guidelines and to give us the numbers of kids and patients that we can evaluate. Residency training somewhere between 10 and 20 max in 3 years. That's not okay. Mental health in the United States is going just huge problems with mental health, and the Academy of Pediatrics is being singled out that we're the ones that are going to be on the firing line because the number of psychiatrists per thousand are going way down in numbers. So now all of a sudden pediatricians are the ones that are going to be in the medical forefront. We need more ways to help the families. We need some more support. We need more support from the academy. We need more support from local and city governments. This is a major, major problem that's hitting the United States. A real hopeful program has been outlined. It didn't really get stated, but it's been outlined. And that hopeful program is an interaction of a team. It's an integrative approach of teacher, parent, physician, child, social worker, the diet nutritionist, the diet, the exercise. All these aspects are coming more to a forefront where pediatricians from the Academy of Pediatrics, really what we've been good for is we send a patient to the psychologist, they come back, say they got ADD, and we give them a drug. This is changing that. This is really exciting that it's not being determined that some test, of which there's no test for ADHD, that there's no just go to a psychologist who says they need this, and I'm not bashing psychologists, but we as physicians got to stand up to help our kids and realize it's not test, it's not done on paper. It's how does the child interact? And with that, I'm very, very excited about the future of medicine.